Welcome to the T. Colin Campbell Center for Nutrition Studies Spotlight on Health. My name is Natasha Lance, and I'm the Chief Operations Officer here at the T. Colin Campbell Center for Nutrition Studies. And this evening, we are bringing to you the title of tonight's Spotlight on Health is Diabetes, Genes or Diet. And our two panelists for this evening are Dr. Milton Mills and nurse practitioner Michael Como. And tonight's session is hosted by Dr. Michael C. Hawley. And Renee Saka is here for question and answer and support. And for those of you who are joining us for the first time, please know that at the bottom of your screen, there is a CC, that's closed captioning. If you need that, just go ahead and click on that box and the captions will appear for you. For those of you who are interested in the replay of tonight's session, everyone who registers for tonight's session will receive a recording in approximately a week following this live session. If you don't see it in your email, please check your spam folder. And if you don't see it there, you can always go to the Center for Nutrition Studies YouTube channel, and it will be there as well. For those of you who have questions this evening, we will start questions at 8 p.m. and go to 8:15. So if you have those questions, please place them in the chat. Renee will be combing through the chat and she will be gathering your questions to ask to our panelists at the end. So please go ahead and use the chat for questions. Without further ado, I'd like to turn it over to Dr. Mike Hawley. Take it away.
Thank you, Natasha, and thank you everyone for joining us for Spotlight on Health, sponsored by the T. Colin Campbell Center for Nutrition Studies. Tonight is diabetes. You know, diabetes is rampant in the United States. 12% of the US population have diagnosed diabetes. More concerning is there's 30 million people that, there's 10 million people that are undiagnosed. And so that's a high percentage. Pre-diabetes, 100 million people aged 18 and up have pre-diabetes. That's 38% of the adult population. So diabetes is the most expensive chronic disease in the US. Complications include heart disease and stroke, eye issues, including blindness, nerve damage, gum damage, and tooth loss, increased risk of depression, kidney failure, and amputations. So here tonight to help us understand more about diabetes and, more importantly, its prevention and treatment are Dr. Milton Mills and Michael Como. Milton Mills, MD, practices outpatient clinic-based medicine in underserved communities in the Washington, D.C. metro area. Dr. Mills is the medical director for the United States Census Bureau in Suitland, Maryland. He is also the founder and president of Physicians for a Healthy America, an organization of physicians of color, focusing on promoting the benefits of plant-based diets. He graduated from Stanford University School of Medicine and completed residency at UCSF Fresno and Georgetown University Hospital. He has lectured and given research seminars through North America, Ireland, and the United Kingdom on several preventative health topics, including negative impacts of meat and dairy consumption on human health, nutrition and HIV and AIDS, nutrition and cancer, and the dietary needs of the various ethnic groups. Michael Como is a family nurse practitioner who lives in the greater Philadelphia area of Pennsylvania. He received his undergraduate bachelor in science of nursing from Villanova University and his master's in science of nursing from LaSalle University. In his 10 years of healthcare service, he has worked in areas ranging from the operating room to acute inpatient rehabilitation. During this time, Michael has seen firsthand the devastating and often preventable effects of the standard American diet and its effect on patients and their families. Michael is now the owner of Primary Prevention Center, located in Newtown, Pennsylvania, where he has devoted his career to helping his patients modify their lifestyle by incorporating a whole food plant-based diet, stress management techniques, and exercise. So Milton and Michael, welcome, and thank you for joining us and discussing this very, very important topic. You know, we hear often patients will say, you know, I have diabetes because my mom has it, or my aunt, or my cousin, and they'll cite their relatives as their reasons for having diabetes. So I want to start out, because our title was, you know, diabetes, diet, or genetics. So what role do genetics and lifestyle play in the development of diabetes?
Dr. Mills, you want to go first, or?
Well, sure. I'm just gonna let you guys know this is gonna be a bare knuckle brawl as far as I'm concerned. Because I'm gonna be very, very straightforward. So in one sense, I tell people that looking at the role genetics plays in our risk for developing type 2 diabetes, and I'm going to be focusing on type 2 diabetes, and at some point we can talk about the distinction between type 1 and type 2 diabetes. But type 2 diabetes accounts for 95% of the diabetes that we see in the United States, and that's typically what most people are confronting when they talk about and deal with diabetes. It's what's called classically adult onset diabetes. But the risk for the genetic risk for type 2 diabetes can be looked at similarly to the risk that we have for drowning. So having lungs puts us at risk for drowning, but only if we get into water over our heads. And likewise, having our genetic risk for type 2 diabetes is entirely dependent on what kind of diet we consume. I tell people now that type 2 diabetes is a choice. It is absolutely a choice. If you have type 2 diabetes, you are choosing to have that disease, because if you are willing to make the type of dietary changes that can reverse the disease, you can reverse that disease in 85 to 90% of cases. Now, there are a few people who may have had type 2 diabetes for such a long time that they have burned out their pancreas to the point that they can no longer manufacture enough insulin to control their blood sugars. But those, by and large, are very rare cases. For most people with type 2 diabetes, if they are willing to make the kind of big enough dietary changes, they can put that disease into remission. So if they have it, they are choosing to have it because they're not willing to make the kind of changes they need to make to reverse it. So, and the reason that, as the expression goes, the reason diseases run in families is because eating habits run in families.
There you go.
And that is why, you know, grandma, mom, and, you know, aunts and uncles have the same diseases, because they all eat the same way. So again, if you make the necessary changes, you can reverse the disease. And I'll leave it at that, and then give Mike a chance to put his 2 cents in.
Yeah, sure. I mean, I just want to piggyback exactly off of what, Dr. Mills said. It's lifestyle. And as he said, what grandma eats, what dad eats gets passed down to what son eats, right? And so what are we eating though? It's fat, right? We are consuming massive quantities of fat. And there's a word that I want people to kind of take in and really bury this in your brain, right? It's lipotoxicity, okay? We are living in a toxic culture, toxic with fat, okay? So, what's going on in the body when that happens, right? Well, glucose enters the bloodstream, insulin enters the bloodstream, it gets to the cell. The insulin's supposed to unlock the cell, let the glucose in, but there's fat globs in there stopping the insulin from doing its job. Okay. So that's, I mean, it's as Dr. Mills said, it's pretty simple. The problem is that, like he said, are you willing to make the changes necessary? Because like he said, it is a reversible disease. In 98% of the people who have it is a reversible disease. It is a choice. Do you want to be diabetic? Do you want to be on insulin? Do you want to, take 6 or 7 different medications? Do you want to go blind? Do you want to have kidney damage? Do you want to lose a limb? Or, do you want to eat a whole food plant-based diet? And I think that choice sounds pretty easy to me. I just kind of agree with everything he said and just add that little extra thing on there. But remember, it's fat. It's what we're eating. It's a lot of fat.
Yeah, and I want to drive that home because you rarely hear physicians say, your diabetes is caused from fat. What they say is you need to cut back on your carbs, too many carbs. So I want you to elaborate a little more. You were touching on the mechanism of insulin resistance, which is, what type 2 diabetes is about. So help us make clear the role of fat in insulin resistance versus too much carbohydrates.
All right. So I want to say that one of the major problems in the United States and other Western countries is that people have been lied to. People have been told that they are, quote, omnivores, that they are supposed to eat both animal and plant foods, and that they are supposed to kind of have this complicated regimen of this percentage of animal foods and this percentage of plant foods, and they try to do this complex juggling acts of this amount of animal foods, this amount of plant foods, and it's that that juggling act that gets people into trouble, and because it's the animal fat especially that is extremely toxic to our systems. But it's not just the animal fat, it's also the animal protein that is very, very toxic to our cells, and that causes induces genes that and gene products that engender insulin resistance. So the first thing that people simply have to understand is that we are not omnivores. We are herbivores. We are strict plant eaters. And when we adhere to a plant-based diet, but not a bizarre plant-based diet that is built on these toxic man-made plant foods that are comprised of processed carbohydrates that are made up of fiberless sugar containing high fat candy and popcorn and all the garbage that you see and packaged foods, but when you adhere to a whole food plant-based diet that is actually comprised of plant foods that are foods that came out of the ground, came off of a tree, or are intact plant foods, that's when your body is able to restore itself to health, to your genes are able to interact with the foods that you eat in ways that allow your body to make healthy gene products that actually create health. So that's just the fundamental point. And I'm going to make this last statement that for a lot of the people listening to what I'm saying, they might think, Dr. Mills is probably drunk, or maybe he's he's doing drugs before he got on this call. So, but I assure you, I'm not. I don't have any medications or drugs that I'm doing, and I would challenge you to do a 12-week experiment. Try a whole food, entirely plant-based diet for 12 weeks and see what will happen. If at the end of the 12-week period, you find that your health is no better than it was at the beginning, then you go back to doing what you were doing before you started it. But I guarantee you, you will, by the end of that, before the end of that 12-week period, you will have reversed your diabetes and will probably be off of all your medications before that period ends.
So I just want to add to that, because, I think that, one of the issues that we face is, you go to your doctor, you're diagnosed as a diabetic, and your doctor says, well, and I've seen this so many times,
Mike, can I stop you for a second? Somebody's got to mute themselves, because you're interrupting what Mike is trying to share with us.
Yeah. Okay. You good?
Dr. Milton Mills.
You go to your doctor tells you, well, you're officially diabetic now, right? So what we want you to do is eat a high protein diet, low carbohydrate, okay? And this is what they tell you. And what will happen is, your blood sugar scores might drop. Your A1C may come down, but it is artificial. You are not helping your diabetes. You are not restoring your body to its natural function. What you are doing is you are eliminating carbohydrates. You are eliminating your body's preferred source of energy from it, right? And so when you go and you begin to eat an apple, or you eat some fruit again, your blood sugar is going to spike again, right? Because you have not fixed the insulin resistance problem. You have just avoided the carbohydrates that we get from fruits and vegetables and things. So to really correct the problem, as Dr. Mills said, you need to avoid these toxic meats and products. And by the way, just so you know, right, you could eat Doritos all day and be considered a vegetarian, okay? So we're not eating Doritos, okay? That's what he's talking about when he means all these highly processed and some of these veggie burgers that you find and all that kind of stuff. You could technically be considered on a plant-based diet when you eat potato chips, right? But that's not it. But the point being is that, to correct the problem, you have got to eliminate the animal products. I mean, it's just, I guess as simple as we can really make it. That's the point of this whole thing, because doing it the other way and doing it the way that people have been sort of taught to do it for years, high protein, low carb, you're not fixing your diabetes. You're just artificially masking the problem. So
you're treating symptoms and not the underlying condition. Exactly right. Exactly.
And you're giving people false hope.
Yeah. Yeah. So just to clarify for our audience, what is the difference between type 1 and type 2 diabetes? Milton said that 95% of diabetes is type 2. What is type 1 diabetes?
So type 1 is basically an autoimmune disorder where something triggers your body to attack itself, and then you no longer produce insulin at all. Type 2 diabetes, you're producing the insulin, you've just become resistant to it. Whereas type 1 diabetes, you're not producing any insulin at all. And so, those people need the insulin injections and that type of stuff. But it's and what we were talking about earlier, as far as genetics goes, now there is some linkage in genetics to that. But there's also been a study that, they took sets of twins, and, one twin got type 1 diabetes, the other one did not. Okay. So, but they're both genetically identical, right? So what is going on in their bodies? And, I think it's less than 50% of identical twins who have type 1 diabetes, the other one gets it, right? So there's something else that's causing this autoimmune disorder that attacks the body. And, I think that there are some studies out there linking that now to things like dairy products, to be quite Dr. Mills?
Yeah. So, in fact, the American Academy of Pediatrics strongly urges parents not to expose children to cow's milk prior to the child being 1 year of age. And what's magical, and so the question is, well, what's magical about a child being a year of age or older? Well, it turns out that children less than a year old do not make all of their protein digesting enzymes. Why is that? It's so that they can absorb intact antibodies from their mother's milk. So they don't break proteins down into their individual amino acids. They break them down into large fragments. But that means that when they absorb antibodies from their mother's milk, they will absorb those antibodies intact. But what happens when they ingest cow's milk is they will break those BSA, bovine serum albumin proteins down into large fragments. And in genetically susceptible individuals, those BSA protein fragments are broken down into protein fragments that child's body will recognize as foreign proteins and will make antibodies against them. And again, in certain individuals, the antibodies their body will make against those BSA fragments cross-react with proteins on the surface of the insulin-producing beta cells in that child's pancreas and will kill those beta cells. And so that's why, and we don't really know who the susceptible individuals are necessarily. And so that's why they say, don't expose any child to cow's milk until they're at least a year of age or older. Obviously, it makes sense not to ever expose them to cow's milk. And because it also turns out that it's not just cow's milk that can do this, but it's actually other types of animal protein that can sometimes trigger this toxic antibody response that can kill off beta cells. And once you kill all the beta cells in a child's pancreas, that child can no longer produce any insulin. And as a result, they then become dependent on giving themselves exogenous insulin for the rest of their life. And they are a type 1 diabetic. So they're entirely insulin dependent for the rest of their life. So type 1 diabetes is a autoimmune disease where for whatever reason, they have destroyed their insulin producing cells and they become insulin dependent for the rest of their life.
Yeah. And just one more thing to add to Dr. Mills' point there, these children who end up in this situation, they're much more prone to depression. They're much more prone to anxiety, even suicide, because type 1 diabetes, if you don't know anybody or you've never been around anybody who has it, is extremely difficult to manage. It is extremely difficult to manage, especially for a child or the parents of the children. So, nowadays, what we do is everybody's, this test and that test. Is my baby going to be healthy? Is this going to be healthy, right? Well, this is a simple step that you can take right here to give your child a much better chance at a healthy life by just eliminating something out of the diet. There's a lot of things that we can't control, but what Dr. Mills is talking about, that is completely under your control. And it goes back to what he mentioned in the very beginning. It is a choice. Now, type 1 diabetes, that's a little bit different, but still the choices that we make, especially as far as our diet goes, are going to either have positive consequences or negative consequences. And there's really not a whole lot of gray area in between there.
Right.
Yeah, excellent points. And switching about to type 2 diabetes just a moment. Tell us about prediabetes, because there's a lot of people with prediabetes and a lot of people with prediabetes that are undiagnosed as well. Talk a little bit about prediabetes.
So, prediabetes is that stage before diabetes, obviously, right? Diabetes is not something that happens overnight. You don't wake up one morning and become a diabetic. Okay, this is a disease process that happens over years, 20 years, 10 years, 15 years. It's a long process. And so while your body is still producing insulin, right, in a type 2 diabetic, and you are still responding to that insulin, the response is becoming less and less and less and less. And so over time, the glucose in your bloodstream is building up. And so there's already damage beginning to be done at this point in time, right? Everybody thinks, oh, now I'm diabetes, now I have to worry. No. You need to be worried now, 5 years from now. And so, I think I'll let Dr. Mills expand a little more, but, pre-diabetes is basically, I would sit here and tell you that it's as much of a dangerous phase as actually being diabetic.
Yeah.
So one of the interesting things that I am seeing in the clinic I'm now working in is the degree to which people who are not, quote, diagnosed as diabetics have evidence of chronically elevated blood sugar that would be considered prediabetes. So, and people will say, is that a problem, or why is that a problem? So there's a value that we look at called the hemoglobin A1C, and that's a term that's tossed around a lot that shockingly doctors almost never explain to their patients what it means. So what is the hemoglobin A1C? Well, the way I explain it to my patients is as follows. Sugar is fuel. And the reason it's valuable is because it can be burned or combusted in the presence of oxygen. So you think about it the way you would natural gas or gasoline. And we like natural gas because we use it in our homes to power our stoves or our furnace. And you want it so that when you turn the stove burner on, the eye pops on so you can heat up your food, or you turn the furnace on and it will warm up your house, but you don't want it to flood the house with natural gas because the house will blow up. You don't want it to flood the range because it'll catch the house on fire. Likewise, in your body, the body wants the sugar available so that the cells can pull it out of the bloodstream and use it to power the energy that they need, but you don't want it so high that it starts to essentially burn up your tissues. So the body likes to keep it tightly regulated. And we know that when blood sugar is kept within the normal range, a very small percentage of the proteins in our body react with those sugar molecules. And that narrow range is about, I would say, 4.5 to say 5.5% of the proteins in your body react with these sugar molecules. Well, since red blood cells live 90 to 120 days, you draw blood from someone, you look and see what percentage of red blood cells have sugar molecules on them, and that tells you what your average blood sugar has been for the previous 3 to 4 months. As the sugar level rises and remains elevated, a larger and larger percentage of those red blood cells begin to react with those sugar molecules. And we know that when that percentage goes above 6.3, that's diabetes. Well, the problem with that is that as that percentage gets higher and higher, you start to essentially get caramelization forming on your cells. That caramelization will clog up your arteries. It will damage your cells so that they don't function properly. And ultimately, you will essentially burn your tissues. That is what diabetes does when your blood sugar level is out of control. And it will destroy your retinas. It will clog up the arteries in your kidneys, your heart, your penis, which is why people get ED. It will clog up the arteries in your extremities, which will lead to gangrene and amputations, and in your brain, which will lead to strokes and dementia. And that's why diabetes is such a devastating disease and will ultimately kill you well before your time if we don't control it. And that's why we got to get this disease under control. Otherwise, it will destroy our bodies and destroy our lives.
Yeah.
So that's kind of a crude way of conceptualizing.
That conversation is happening to your nerve cells as well.
Oh, yeah.
You know, one of the nastiest things, Dr. Mills, and I'm sure you can attest to this, is diabetic gastroparesis.
Oh, my goodness.
Absolutely horrible, horrible disease process.
And neuropathy, yes.
It's not understanding correctly that diabetic gastroparesis is when, you know, you have nerve cells throughout your body. Well, your gut operates off of these nerve cells, and when they're not working properly, your gut motility slows down, and in some cases can stop altogether. And that is when you start to get, you know, bowel blockages. Next thing you know, you're in surgery. Next thing you know, you're walking around with a colostomy bag. So, you know, I like what he said there, caramelization. Think about it like that. Think about caramel just dripping greasy, thick motor oil, you know, in your body. And what's that doing? That's a great analogy there, Dr. Mills.
Yeah, excellent, excellent. So if I'm in the audience right now and I have prediabetes, or maybe I have type 2 diabetes, lay out some black and white, hardcore recommendations. How am I going to reverse my diabetes, or how am I going to reverse my prediabetes? Give me some specifics. What can I do?
Well, the bottom line is, and this is, I tell patients all the time, you can't repair fire damage to a house that's still on fire. Okay, so the first thing we got to do is we got to put out those fires. So I tell my patients we're going to use a combination of medications and diet change to put the fires out. So yeah, we're going to use medicines, but that's not all we're going to do. We're going to use the medicines to get the fire out, but then we're going to use diet change so that we can wean you off the medications, so that your body can start to repair itself. And as it does, we will start weaning those medicines off. And the fact is, and the amazing thing is, and the wonderful thing is, that as you change your diet and your body starts to respond to its own insulin more effectively, we will be able to get you off those medicines, and your cells will start to remake themselves. Your body will start to remake itself. Your cells will start to respond to that insulin more effectively. As Mike was saying, as your cells start to empty themselves of that intracellular fat, the insulin starts to work more effectively. You will need lower levels of those medications, so to the point where you won't need them as much or at all. And again, you start to cure yourself of diabetes. It is absolutely possible. It will take some time, which is why I say you want to allow about 12 weeks for this process to occur, but eventually you can reverse this process. And in a lot of cases, depending on how severe the severity of your disease, it may not even take a full 12 weeks before you really start to see the impact of this disease. I will tell you, I had one of the patients that I had in my clinic. When I first saw this woman, when I first started in clinic, she had a A1C of, let's see, I think it was about 10 something, which is just off the charts. She was depressed, she was confused, she couldn't see very well because her eyes were so messed up. And, talked to her about her diet, tried to encourage her. Make a long story short, she agreed to start changing her diet. Saw her about a month and a half, 2 months later. By that point alone, her A1C had come down to 7.9. She was in tears because she told me she hadn't had a A1C of 7 for over 42 years. How did she know? She said, because that was when her daughter was born. It's the last time she had an A1C of 7. So you can start to see traumatic changes really quickly if you make the appropriate changes. And I mean, she's continued to improve, but I'm just citing her as an example of just how quickly our bodies can really start to heal themselves when we start making the appropriate choices. So the point is that, yes, there's hope, and we can make really dramatic changes if we are willing to do what's necessary.
Michael?
I mean, I really can't add much to that. I mean, he hit the nail on the head. What I will say is, though, if you are sitting in a situation, and I see some of the questions popping up, and I'm sure, there's people that have friends or family members that they look at, and, you can kind of see when somebody's health is failing or whatever, or they get checked, right? Go get checked and find out where you stand at this very point, so that you can get to a Dr. Mills' office. You can come to somebody like me, and then we can begin to work on it. Dr. Mills made a really good point, and I see this all the time in my practice where, there's people that are just, they don't want to be on any medication, right? And I think that, with the way that things are nowadays, and there's this conspiracy and that conspiracy, some of these medications are good and they are necessary. They are a necessary starting point for some of the patients that we see, right? You have got to start somewhere, and they're necessary, and they save lives. The thing that we need to impress upon people as well is, though, this is not a life sentence if you choose to make different choices, right? It's a starting point. We have an ending point we want to get you to, but you've got to make the choices along the way. And I would say in the beginning is, make sure that you're getting your checkups, make sure that you're getting your blood work done, make sure you know where you stand right now. Because if, it's like you said, millions of people are walking around right now and have no idea what is going on inside their bodies. And most people don't find out until it's too late.
Right.
And so, that's what I would just add to that,
So what I've heard you both say, step number one, get the animal products out. You're going to get a lot of fat out and a lot of the animal protein out. What about, I hear people say, oh, my doctor said I can't eat fruit because I have diabetes. What would you comment? Can I eat fruit if I have diabetes?
Absolutely.
Yeah.
Absolutely. Yeah. I mean, listen, fruit has fiber in it. Go ahead, doctor. I was going to say, yeah.
Well, I have a favorite story that I love to tell, and it's about a patient that of mine that I saw. Her name was Kathy, and this was over 20 years ago, actually closer to 30 years ago, when I used to work in a free clinic. And when I started taking care of Kathy, she had been diagnosed with diabetes for over 17 years. She was on big doses of insulin twice a day, plus glucotrol twice a day, and still her sugars were 200 to 300. She had severe claudication. She couldn't see well. She had become disabled, had to quit her job, and talked to her about her diet, and Kathy just went vegan overnight. And I quickly started having to wean her off of her all of her medicines, and she ended up coming off of her blood pressure medicines. As she was really starting to heal, I started encouraging her to eat fruit, because I wanted her to get those antioxidants and phytochemicals. And she kept telling me, no, Dr. Mills, I can't, because it's too much sugar. And I kept saying, Kathy, the fiber in the fruit will modulate the absorption. And she said, no, my doctor's always told me. And we went back and forth. And finally, she got angry at me. And so she decided, and you should know, we were actually, we went to the same church. So she actually had my personal cell phone. And so one night she got sick of me telling her to eat fruit, and she decided she was going to teach me a lesson and eat some strawberries. And she called me up at 9 o'clock at night, and she was so excited. She said, Dr. Mills, I ate some strawberries and it didn't raise my blood sugar.
Yeah.
And she was just in tears. And I think we both cried that night, because it was just such an amazing moment that she realized that, she could eat fruit, because the fiber in the fruit would keep her sugars from spiking. So yes, you can eat, and not only can you, but you should eat whole fresh fruit, because it's important to have those nutrients, and the fiber, both the and the soluble fiber will help control the blood sugar. What you should not eat are canned fruits and things like that, but whole fresh fruit or frozen, yes, that's all good.
Perfect.
And important to do.
Yeah, remember, fructose in whole fruit, that's not your enemy.
Right.
The fat
Exactly.
is your enemy.
Right.
Right? And that's what I think that's what this sort of, what we've been talking about sort of this whole time here, is that, the fat and the inflammation that comes from the animal proteins is the real culprit here. An apple is not the enemy. Okay.
I like that.
Yeah. And, Milton, you made a very important point. When I talk to people about, reversing their diabetes and going on whole food, plant-based diet, I always caution them to work with their doctor, particularly if they are on medications, because as you said, you're going to need to wean some of those medications over time as you reverse your insulin resistance. And sometimes people say, I tried that plant-based diet, I got lightheaded and, all these side effects, my blood pressure or whatever. And so I encourage them to work with their doctors, because the medications they're on are going to be, most of the time, reduced and eventually eliminated.
Right. One of the most awesome developments recently that have come out are the continuous glucose monitors that are available now. I wish I could get those for every patient with diabetes, because they can make certainly, especially weaning people off of medication so much easier, because you can get moment-to-moment monitoring of a patient's blood sugar, as opposed to having to do finger sticks all the time. Of course, part of the issue is a lot of times some insurances might not cover providing those continuous monitors for patients. So you just have to see if you can get the insurance plan to cover the continuous monitors. But if they can, that will make the weaning process so much safer and easier. But it's critical to monitor the blood sugar frequently, so that you know what you're doing to keep patients from bottoming out as they're coming off these foods that tend to cause hyperglycemia, and switching to a type of diet that will help them get better blood sugar control.
Perfect. Yeah. One of the things I often ask with type 1 diabetes, patients will say, well, it's not reversible, so what can I do? Talk briefly about lifestyle changes and improvement in diabetes in general, including 1 and 2.
Well, I think, for type 1 diabetes, unfortunately, these people that find themselves in that situation are always going to have to use insulin, right?
Right.
But the thing is that once that insulin is in their bloodstream, the job is still the same. And the barriers to the insulin doing its job are still going to be the same, right? So if you're consuming this diet that's high in animal protein and saturated fat, and all that fat and stuff is still building up in your cells, then you're going to need more insulin to do the job, right? So from that perspective, people who have type 1 diabetes who choose to go on a whole food plant-based diet and begin to reverse that lipotoxicity that we mentioned earlier, while they're still going to need to administer insulin to themselves, they're going to need much less of it to do the job, to do the trick, and so that's a big benefit for people that fall in that situation. And then, it's the same thing. I think Dr. Mills just really hit the nail on the head and covered it really well, especially for type 2 diabetes. It's gonna be the same process. The difference with type 1 and type 2 is that the type 1 person is going to have to administer their insulin, right? The type 2 diabetic still produces it. But the gist of the problem is, what is the insulin doing, and what are the barriers to it working once it's in the bloodstream?
Yeah,
right. That's the issue.
Yeah, and Mike just really made just a super important point, and that is that the plant-based diet will allow the insulin to work so much better. And even with the type 1s, you don't want to have a hyperinsulin situation in your body. So the less insulin you have to use, the healthier your body will be. And so even for type 1 diabetics, when they are plant-based, they will need less insulin, and that means that they will be healthier overall, because a body that has too much insulin will predispose you to developing cancers, to having other metabolic problems. And so you want to have a situation where you're needing as little insulin as possible. So being plant-based, even for type 1 diabetics, it means that they will be much healthier. They'll need less insulin, and studies have shown that over time they have fewer long-term complications, and they live longer and are healthier. So yeah, it's better for type 1 diabetics as well. So very good point, Mike.
Perfect. So yeah, it's not a different diet for type 1 and type 2. It's all the same. Get out the animal protein, get out the animal fat. At Center for Nutrition Studies, we like to, rely on the evidence and the science. Where are we with diabetes and lifestyle nutrition? Are there studies demonstrating what we're talking about here tonight, reversal and improvement of diabetes with plant-based nutritional approach?
Absolutely. There was a study, and unfortunately, I don't have it at my fingertips. Mike, maybe you do. I know that there was a large study that was actually done over in Europe, where a researcher showed that she was actually able to get a reversal, of 85, over 85% of the participants in the study, get them off their diabetes medicines by putting them on a plant-based diet. I can't recall the name of the study, but that's at least one study that I'm thinking of, but there have been many studies.
There's
Yeah,
many
that's
ways. I
strong,
mean,
strong evidence.
yeah, I mean, the old Google's beautiful, isn't it? I mean, you can go on there and you can, if you're looking for the validation, it's there.
Mhm.
It's there. I mean, you know,
And
Yeah.
I've seen it firsthand. Yeah.
yeah, and I have too.
We have all,
There's
yeah.
somebody who needs that, that extra boost.
Yeah.
It's out there. It's not hard to find.
Yeah, one I had that was unique a little bit is a type 2 diabetic. He was not obese and he had type 2 diabetes for many years, high fat diet, got the animal products out. Within 3 to 4 weeks, he was tapering medication and he was a believer, and he was very skeptical. He didn't want to try it, but we haven't, touched on obesity and its role in diabetes, but many type 2 diabetics are obese or overweight, but you don't have to be to have type 2 diabetes. Yeah.
And I think that's one of the problems, is that there are people, who go on these very high protein diets, people who are big fitness fanatics and some of the bodybuilders and things, right? And these are the people who are walking around right now who have no idea that they're taking time bombs.
Exactly. Good point, Michael.
Yeah. Well, and what's fascinating, I just want to throw this out, is that studies have shown that in people of Asian ancestry, they actually tend to develop type 2 diabetes at much lower body weights than people of Caucasian or African ancestry, because they're again less genetically adapted to a Western style diet. So it's like their cellular machinery tends to go off kilter much more quickly when they are exposed to Western eating patterns. And so, they tend to become diabetic at much lower body weights than we see in other ethnic groups.
Excellent point. And speaking of that, I want to close us out with looking at the disparity amongst race. African Americans were 60% more likely than non-Hispanic white adults to be diagnosed with diabetes by a physician, and 2.5 times more likely to be hospitalized with diabetes and associated long-term complications than non-Hispanic whites. Comment on that for us.
Well, again, it's thought to be due to the presence of, at least in part, to what are called thrifty gene complexes. And again, when you look at traditional West African diets, which you look at West African genetic background, because that is where New World Blacks were drawn from. That's where the population that were brought to the Caribbean and Americas as enslaved people were brought from. The diets were traditionally largely plant-based diets that contain no dairy, were low in fat, built around whole plant foods, whole grains, contained low amounts of animal protein, and so those are the types of diets that New World Blacks are genetically adapted to. And so when they then start to consume a calorie-dense, low fiber, high protein, high animal protein, and especially dairy-containing diet, that just creates a lot of physiologic toxicity that results in excessive rates of disease in these groups. And similar patterns are also seen in indigenous people in the New World, Native Americans, and it's just devastating, absolutely devastating.
Yeah. In fact, the rate in indigenous is the highest
Right.
Yeah, exactly. Good point. Michael?
Yeah, I think, there's also that something that comes into play here, and there's lack of opportunity, right? There's food deserts. People live in areas that are just completely void of the foods that we're talking about. I live outside of Philadelphia now, but when I lived in Philadelphia, every corner had a corner store on it. And let me tell you, what we're talking about here was not being sold in those corner stores. Okay. But it's so much easier. And I mean, there's people who literally live off of that kind of diet, and they don't have access to, the foods that we're talking about. And even if and even if some of people can get to these kind of foods, I think there's, a lack of the education too in there, which, I think Dr. Mills is really doing a good job of trying to bring that in to all communities, right? But I think it's especially in some of these more disadvantaged communities, there's just a lack. And I mean, there's a lack of a lot of things that play into, the already susceptible genetic makeup of these people that Dr. Mills mentioned, Native Americans and African Americans.
Yeah.
But I also just want to be very clear that I don't want any Caucasian American to leave this meeting thinking, well, Dr. Mills said that these diets are really bad for Black people and Native Americans, but as a white person, I'm cool. No, that's not what I'm saying, because it's a difference between a Black person or a Native American person jumping off a 50-story building and a white person jumping off a 30-story building. Both of you guys are going to die. It's just somebody's going to make a bigger splat. So it's not good for anybody. Okay, so let's be clear about that. All right.
Yeah. Great.
I want to be crystal clear. It's not good for any of us. All right.
That's good. That's good. So I don't know if this is possible, but a 1-minute summary, closing thoughts from each of you.
Well, the one thing that I want to say in summary is, because I remember when I confronted my own personal point of change, of considering change, one of the things that I thought about was, but I like, but I'm going to miss, until I had to realize that, I didn't have a conversation with my obstetrician in the delivery room, meaning that I was born without preferences. Everything that I thought I loved and liked were things that I was taught to like. And so I want people to understand that all the things that they think that they, really love are things that they were taught to like. And as learned habits, they can unlearn those habits and learn new ones. Because for most people who are in relationships, you are not in a relationship with the first person you fell in love with. And if you think back to that first person that you fell in love with, there was a time you thought you couldn't live without them. And then they did something like slept with your cousin or spent all your money. And you said, you know what? I got to get rid of this fool. And just as you got out of dysfunctional relationships, you can get rid of a dysfunctional diet and learn to love something new. And when you learn to love that new thing, you love it as much or more than you love the original thing. And especially when it's doing something much better for you. So please get rid of the dysfunctional diet and embrace something that is going to keep you healthy and help you live longer.
Great advice. Thank you. Michael?
Yeah, I think what I'll say is kind of going back to the very beginning of this chat, which is, this is a choice. You have choices of what you're going to do. And so what I would really say to people is, when you begin and you have made this choice to change your life, it has to be an every day, every minute, every hour thing. And what I mean by that is, so often, all of us, I'm guilty of it. I'm sure, you guys have been in this situation where we just eat to eat. You know, if you are in a medical job like I am and you're constantly running and going, you know, the vending machine can become your best friend. Okay. So I think that we have to really start to look at food and when you look at that food, see what it's going to do to you. Okay. Remember what Dr. Mills said about caramelization, you know, the gunk that's going to be in your body. And when you see things like that and you picture that, that will help you to make that better choice in the long term or in the short term. Right. So really being conscious about what we're doing. You know, changing habits is not easy. You know, if it was, then we wouldn't have a lot of these issues that we're facing right now. So every single day that you wake up, you know, you really have to consciously think about putting one foot right in front of the other. It's learning to walk again. But I'm telling you, if you start, the next thing you know, you will be sprinting, and this will be, you know, the old you will be a thing of the past. The new you, medication-free you, healthy you, will be a reality and not just, you know, well, I wish I was this, I wish I was that. It'll be a real you, but it's a choice and it takes time and you have to really consciously think about it on a daily basis. So that's what I would like to leave everybody who's watching kind of with here.
Great, great. Thank you, Milton and Michael. This has been excellent advice, excellent discussion. And we're going to bring Renee in, and we're going to have some questions from our audience for you all.
Can I just point out one thing real quickly?
Sure,
I
Milton.
just noticed that Mike has on like a gray scrub, I mean a black scrub top with a gray t-shirt, just like me. We did not call each other. that just happened. Which is kind of cool.
Uniform for the night. Yeah, excellent.
Well, thank you guys so much for this great content. And we have had so many questions coming in. So I'll start it off with one of the first questions. What about physical activity? How much of a role does that have in helping with improving diabetes as well?
Oh, it's tremendous. You know, it's really one of the best ways as you know, on top of the diet is to, you know, help your insulin sensitivity and help, you know, you know, even a 10-minute walk after a meal is literally going to jam that glucose that's having trouble getting into the cells. It's going to jam it in there, right? So that 10-minute walk is going to lessen the glucose load in your blood. And then, of course, you know, if you are switching over, you know, to this whole food plant-based diet that we're highly recommending, you know, you're going to, if you're exercising, you're going to, you know, get rid of that lipotoxicity that you're dealing with, which is just going to compound how fast you're going to recover and how fast you're going to improve. So exercise is paramount, at least 30 minutes a day, you know.
I agreed. And with the caveat that it cannot undo the evils of a bad diet. Because if you have a bloodstream full of grease and you're exercising, you're just circulating grease. So you got to get the grease out, then the exercise can perform its magic. But if you got a bloodstream full of gunk, you're just circulating gunk. Remember Jim Fix, the runner? He had a huge heart attack because he was circulating gunk. So get the gunk out, and then the exercise is primo.
Excellent. Yeah.
Perfect. We have another question on pre-diabetes. So someone said, I've been eating plant-based off of all dairy and meats for over 30 years, but I still have pre-diabetes. What else can I do to help reverse that?
So at that point, I got to say, I need to know exactly what you're eating to make sure that you're doing like a serious whole food, high fiber, unprocessed type of plant-based diet. And this might be the place where you really want to up, your exercise component. But one thing that Brenda Davis talks about a lot is that there are some individuals who really need to go really super unprocessed. Like, so for instance, she had patients who couldn't do ground whole wheat. They had to do intact wheat berries, because just the act of grinding up a whole wheat kernels increase the glycemic index of the whole wheat to the point that it would throw their blood sugar profile off. So again, that's someone I would want to work with a good vegan dietitian to really take a good look at kind of what they were eating and sort of tailor their food choices to help improve their blood sugar profile.
Perfect. We have another question too. So my doctor has never suggested a whole food plant-based diet. Why doesn't mainstream medicine recognize this? And how do I find a healthcare practitioner that does?
Oh God.
Yeah. So, I mean, for me personally, you know, in all my schooling, and Dr. Mills has a lot more of that than I do. I was never even trained in going through any of this stuff. It's just not, we were trained in medications and that, but never, I mean, I think I had a nutrition course, maybe it was a prerequisite way before I even got into nursing school. So it's just.
Yeah, it's mainstream medicine is geared towards throwing drugs at people. They operate from the disease model, and they're looking for a drug to treat, because they're symptom oriented and they're looking to treat symptoms and not the underlying disease. It's just like if somebody presents with a heart attack, what are they going to do? They're going to focus on trying to open the blockage, but not deal with what's causing the blockage. So you have to look for doctors who are plant-based, who may be part of the American College of Lifestyle Medicine. And unfortunately, there's not a huge number at this point, although that number is increasing. And you may have to go online to engage with those doctors and do telemedicine to get the information and therapies you need for the time being, but it's improving, it's getting there, and a lot of doctors are doing telemedicine, so that is an option in a lot of cases.
Perfect. Another question we had is, are eating plant-based or meat alternatives such as the Beyond Burgers and the Impossible Burgers, is that better or just as bad as eating meat?
It is not just as bad. How do I know that? Because there was a head-to-head comparison between meat and Beyond Burgers done by Stanford University. The study was published in the American Journal of Clinical Nutrition, and it was an 8-week crossover study. They had 2 groups. First 4 weeks, one group ate regular burgers, the other group ate Beyond Burgers, and then the 4-week crossover, the group switched, and they showed that while each group was on the Beyond Burgers, their LDL cholesterol went down, their TMAO, trimethylamine oxide, went down, they lost weight, their blood pressure went down, and when they went back to eating meat, both of those things went up. Now, that being said, these burgers are processed, but they are plant protein, so they're definitely better, and they will improve, certain health indices, but they are a processed product. So you shouldn't build your diet around them. They can be used occasionally as part of a whole food plant-based diet, but they should never be the basis of your diet. The vast majority of what you eat should always be a whole food plant-based diet comprised of fresh whole foods, 40% raw, that's full of like real plants. That is my advice.
They're great for Memorial Day and July 4th.
And cookouts.
Yeah.
Perfect. Here's more of a drug-based question. So how do you feel about Ozempic as a drug to help treat diabetes, especially with the secondary benefit of weight loss, as weight loss is also linked to improved insulin resistance?
So I'll start this and I'll let the doctor finish this one. It's a tough one because I think that there are some people who really, really do need it. You know, some people are in a situation where they really, really do need it. The people who are not diabetic and taking it, they anger me, to be honest with you. I just, you know, it's one of those things that, and by the way, these medications are causing some really terrible side effects that people are not being told about, from everything from constipation, diarrhea, dehydration, to depression, okay? I mean, think about what we've been talking about here this whole time. These foods that we're eating are highly addictive, that a lot of people are eating are highly addictive, right? So when you start giving somebody a medication and you automatically take their appetite away, and they're not eating these kind of foods that trigger all these pleasure sensors in the brain anymore, right? What's going to happen, right? So there's all these different side effects of them. So it's kind of a two-edged thing. I think that they are necessary. It's like Dr. Mills talked about earlier. We're going to start you on a medication, but we are going to work to get you off of it. And I think too often now, too many people are getting on these medications with the idea that this is it. I don't need to get off of it. This is just going to be what it is for me now, you know? And I think I don't think that's a good thing, to be honest with you, but I'll let Dr. Mills.
All right, so I'm gonna be very facetious. You know what's a great weight loss drug? Smoking meth. It will help you lose weight very effectively and really quickly, but it's not healthy. So, and I'm saying that to make a point that, yeah, these drugs can help people lose weight, but as Mike was pointing out, they come with a cost. So, you know, I would say that I'm not going to say people should never ever use them. I would say that they are drugs, and they have side effects, and they are dangerous, and they are not the best solution. And if you use them, you got to be really careful, and you should have an endpoint, and try. I mean, it's always best to try a more natural life, effective lifestyle approach, but to if you use them, to really have a defined endpoint in mind, because that will just take you down a different dark alley. So it's best if you can avoid them, but if you use them, please be careful and try to use them judiciously and for a very limited endpoint, because people are getting into trouble with these things.
Yeah, and I'll say this, just to follow up on that. Go to a medical provider and get them. Don't get them from these online clinics.
Oh God.
You know, that somebody's going to mail you these drugs in the mail and you're going to start injecting yourself. Please don't do that.
You might as well do math.
Right. Yeah. But please don't do that. Okay. Go, if this is something that's on your mind or on a family member's mind or on a friend's mind, have them see an actual doctor in the office and go over a plan, just as Dr. Mills said. Please don't go to these clinics where they're going to mail you something in the mail and you're going to be administering this medication when, just please don't do that.
Get into real trouble.
Yeah.
Yeah.
Thank
Well,
you guys so much. That this is about time, so I'll pass it right back to Mike.
yeah. So Milton and Michael, excellent discussion, excellent advice. You know, the take home message is get to the cause of the illness, and the cause is the lifestyle and diet. So I really appreciate your time, Milton, Michael. I know the audience has a lot more questions, but our time is out. So on behalf of Spotlight on Health, we thank you for your time.
Thank you. Thank you for
And,
having me.
Our pleasure, our privilege.
Are those real tomatoes behind you? Because they are like just got mesmerized, man.
No, that's something that CNS gave me, so I don't know. They're not real.
Oh, okay. All right.
So our next Spotlight Health is going to be in March. Stay tuned for the date and topic, but it's going to be exciting. I will tell you that much right now. So on behalf of T. Colin Campbell Center for Nutrition Studies and Spotlight Health, I wish you all a great evening and thanks for joining us.
Thank
Thanks
you
for
all.
having me. Great.
Have a great night.
All right.